Hello everyone, welcome to my channel. My name is Rolake Ajibola. I'm a registered nurse. To my returning subscribers, I welcome you to my channel again. And if you are viewing my channel for the first time, I also welcome you to my channel as well. My channel is all about enlightening individuals, families, and the public about some health challenges that can be prevented or managed appropriately to prevent complications. And mostly, I use my channels for women's health. And today, I'm going to talk about eclampsia in pregnancy. Please don't go away. Let's learn together. Come along with me. Welcome back to my channel again. Today I'm going to talk about eclampsia in pregnancy. What is eclampsia in pregnancy? Eclampsia in pregnancy is a complication from preeclampsia and characterized by a seizure fit. So the reason why I'm doing this video today is as a result of a video circulating on the internet about a pregnant woman who loses her life due to eclampsia in pregnancy. May her soul rest in perfect peace. And thank God, the Lagos State government, the agency in charge of monitoring these health issue and health facility, has stepped in to investigate the matter. And we are all waiting for the outcome of the investigation, if it's going to be known to the public after the whole investigation. So I'm going to talk about the cause of the seizure fit, which is as a result of eclampsia in pregnancy. Previously, I've done a video on pregnancy-induced hypertension and preeclampsia as well. You can check it out on my page. What is eclampsia? Eclampsia is a complication from preeclampsia, which is characterized by seizure fit. The difference between preeclampsia and eclampsia is that in preeclampsia, there is elevated blood pressure in pregnancy at 20 weeks of gestation or more than that. There is protein in the urine. If a dipstick is used, the protein in the urine will be more than 1 plus, and there will be organs involvement such as the kidney, liver, and the brain as well. But there is not going to be present of a seizure fit. A woman in the stage of preeclampsia will not experience any eclamptic fit. But in eclampsia, there will be convulsion fit, and that is the difference between the preeclampsia and eclampsia stage. What are now the predisposing factors for women to develop this condition in pregnancy, which are history of previous preeclampsia, history of previous pregnancy-induced hypertension, which is also known as gestational hypertension, age factor, age lower than 18 years or older than 35 years in pregnancy, forced pregnancy, chronic hypertension, that is hypertension outside pregnancy, history of kidney injury, multiple gestation, diabetes mellitus. These are all factors for a woman to develop eclampsia in pregnancy. The signs and symptoms of this condition, which is severe headache in pregnancy. When a woman is repeatedly complaining of headache in pregnancy, there may be need to investigate what is actually causing the recurrent headache. Blurry vision is another sign of eclampsia. When there is swelling of the face, the hands, and the feet, these are signs of preeclampsia. When there is elevated blood pressure in pregnancy, when there is episode of seizure in pregnancy, these are all signs and symptoms of eclampsia. In some cases, women with pregnancy-induced hypertension alone may be monitored and have no complication till they deliver, and the blood pressure will be well controlled. But when it's moved from pregnancy-induced hypertension to preeclampsia, the woman with this condition have to be monitored appropriately. This is the extent of attending an antenatal clinic. For the woman to be properly monitored, for investigation to be carried out, to monitor the woman till when she would deliver. In pre-eclampsia stage, some may not prone any problem at all. The blood pressure can be controlled and the woman can progress to have her baby. In some cases, it may not go like that. It may progress to eclampsia stage. This is a seizure stage and this is a life-threatening complication. The plan at this stage is to prevent further seizure and deliver the baby immediately. The post-surgery treatment will now depend on the outcome of the surgery. The normal, regular post-surgery care will be done for this woman. Seizure precaution and all other investigation will be done to know the systemic functioning of the woman. Blood study will be done to know if there is any other complication like HELLP syndrome, elevated liver enzyme, and low platelet count. And in this condition, it depends on the extent of the injury to the organs, like the kidney. In some cases, there is kidney injury. They may go for dialysis after the surgery, and also in advanced country, if there is the woman is in coma, if the woman is unconscious, they can actually do a craniotomy to relieve the woman of the irritation that is causing and trigger the seizure episode as well. So the care will actually depend on the outcome of the surgery. Saying this and as an advice that there is option, people should make use of the option of health insurance scheme, like National Health Insurance Scheme. States states also have their insurance scheme that can be accessed by the public as well, not only for salary earners. As a private person, you can actually register for health insurance scheme like NHIS or every other health scheme as well can be done. So this will be a relief on the individual. It's not that the person is not going to pay an additional money, but it will be a relief in case of emergency. So as a family, if you have registered for your NHIS or any health health insurance scheme early in your pregnancy, all things being equal, before you actually deliver your baby, you should have been able to access care through this health scheme. Is very important to prevent to prevent any unforeseen problem that can arise as a result of pregnancy is so important. No woman deserves to die as a result of pregnancy. So I've come to the end of this video. Thank you for staying with me to the end. And as an expectant mother, I wish you happy delivery, healthy delivery,